Hello, everyone. My name is Snehal Desai, and I'm a pharmacist. I'm just going to briefly go over some of the cardiovascular hypertension uh, mechanisms, particularly some of the first line agents, um, just so you guys get a little bit of understanding of how some of the uh, medications work in terms of treating high blood pressure. Um, a lot of uh, medications that you may encounter are things like you may have encountered these in practice, like lisinopril, amlodipine, losartan. You may have encountered like hydrochlorothiazide. Um, so I'm just going to quickly just go over some of the mechanisms just so you guys can not only see the picture of how they work, but also to have a clear understanding of what is occurring in the body when this medication is taken. Um, Part of what you should understand is the NAPLEX is going to test you to see if you have an understanding of the mechanism of action, which is one of the domains in the NABP NAPLEX blueprint. So these are some of the main topic areas that's covered on a NAPLEX. So I want you all to understand, or at least take some time to review or understand certain concepts from each of these sections. The first one here I'm going to cover is hypertension. You're going to need to know at least the first line agents for this test. So you're going to need to understand what the calcium channel blockers are and what do they do, the ACE inhibitors, the ARBs. You're going to need to know also thiazide diuretics. This is what I'm going to cover in this lecture. Is just a preview. I'm not going full dive in on it because I know that some of you, I don't want to overwhelm some of you here. So I do want to make it a little fun. So definitely, so that you guys can not only just just study or read it, but at least you guys can have a little bit of picturing of how things work, so that when you're counseling patients, at least you can confidently talk to them about these medications, um, just so that they understand it, and you are good at helping them understand how they are taking their medications better as well. So that's that. Hypertension, I just mentioned the four main. For there might be others, but these are the four main that you should know at least for the test, like the ACE and ARB inhibitors. You should definitely know the thiazide diuretics, the calcium channel blockers, um, heart failure medications. Some of the medications that's used for hypertension is going to overlap with heart failure. Um, However, there are some that you're not going to want to use in heart failure, so you want to be able to differentiate between the hypertension, heart failure medications. Same thing for ischemic heart disease and the acute coronary syndromes. You're going to need to know also the acute coronary syndrome, the different types, such as the STEMI, the NSTEMI, and unstable um, angina and all that stuff. The dyslipidemia, the cholesterol. I'm sure some of you have already seen how or dispensed or seen dispensing of like atorvastatin and pravastatin and simvastatin, anticoagulation and antiplatelet therapy. Like, I'm sure many of you see this over the counter, like aspirin or aspirin type products. antiplatelet therapy like ticagrelor, for example, or some other form of, or anticoagulation, or such as warfarin, for example. And I'm sure some of you have seen that, clopidogrel and those kinds of blood thinners. So we'll discuss a little bit on that. Arrhythmias, definitely knowing the arrhythmia classification. That is very important for the exam. So you want to know what the different medications are in each classification. Also, I believe you may also need to know some of the interactions with other medications as well, because there have been times when patients have had some other medications that causes them to get arrhythmias too. So that's also very important to know. So you want to know these different types of medications, and you're going to see a lot of overlapping in some of these other topics. Thromboembolic disorders, that's where, like, things get kind of coagulated, and you're going to see some of the embolic disorders as well, like the DVT, VTE, PEs. You're going to see that. Stroke as well. Stroke, that's also another critical, important part to know about that. I'm sure maybe some of you in clinical or hospitals may have heard about using some IV medications to treat stroke in some patients. Like, you're going to need to know these different types of strokes as well. So I will go over some of these as well. Peripheral artery disease as well. I don't see too much on that, but you may have a question or two on the test on one of those. So that's also another important topic I think you should also concentrate on as well. So these are the main topics, and we will just go over these so that you will at least have an idea of what sections on cardiovascular are covered on the test. And you guys should be well prepared once you know all of these sections. I do encourage you to read your books, go over your notes. Definitely, think about what are the different classifications of the arrhythmias. Do you know all of those classifications? Do you know all the drugs that fit in each class of those? Do you know what the anticoagulation therapy is? I mean, what is used to monitor anticoagulation? When do you use INR versus any other type of test? So you need to know all of that. Stroke, stroke. When should you be giving someone alteplase, for example? I'm sure some of you in the hospital may have at one time or another heard of it or seen alteplase being used on some of the stroke patients. So you guys need to know all of that. So these are important things, and mechanism of action is one of the important parts of that domain that once you know the mechanism, you're probably going to be able to understand like some of the side effects and how it's helping to treat certain diseases. So we will go over a lot of that in these sections. These are the first line agents I have listed here. Now, everything in all of these videos that I'm posting, it's still subject to change, and I'll post updates along the way, or even if anything that I missed in these videos, I will be sure to send you an updated video with the information. So if the information is outdated or incorrect, I will have it updated and uploaded so that you guys can view the most updated material before the exam. As of right now, I think this is going to be the updated material. But again, healthcare things come out, and there's always new research that comes out. You may have in your studies or when you were in school learned how not related to this cardiovascular, but you can see that some of the things have changed because of the changes in guidelines and things like that. So you guys need to also check out some of the guidelines on these hypertension agents, any of the other cardiovascular topics, so that you are at least aware of the new updates as well. I will post these videos so you can use them as a reference. And I do encourage you to use these videos and also study and use them as a side note while you're studying, using your main resources or materials for the test. It's again, like I said in the intro video, that this is a challenging exam, and there's a lot of material that you need to know before the exam. So this is just to kind of get your hands a little wet. It's kind of like a way of just getting yourself more accustomed before, like getting used to before the exam, understanding all of these at least basic stuff. Don't, like I said, before, don't stress out too much. Just do your best, relax, do your best, study everything. Now, when I mean studying everything, don't just don't try to memorize every single word, every single sentence word by word, and try to understand what the dosing is of every single drug. No, you want to just at least have a picture of what's going on when taking these medications. How do they work? What happens if I took another medication that works just like that? You're going to see some overlapping mechanisms here in some of the medication classes. I'm sure some of you already know from school and from previous studies that ACE inhibitors and ARBs are going to use the similar mechanism, just block the different pathways of it. You're going to see that in these slides as well. So I want you guys to understand the differences here as well. So where they're blocking it and what side effects are most prominent in each of these classes. Like you need to know also sodium calcium or calcium channel blockers, um, such as amlodipine. That has also been a frequent case where swelling can occur in the legs. You need to know also something like between ACE inhibitors and ARBs, where ACE inhibitors tend to cause more of a dry cough than ARBs. So you need to know that. Thiazide diuretics, understanding how they work in the system as well is important. You can you just gonna have to understand all these different concepts so that you can master this portion of the exam. So that's pretty much it on these sections. Let's get right into it. So we'll talk more a little bit in depth we'll go a little bit into these sections so you guys have an idea of what to look for on the exam. And you guys should try to draw these things out yourself to see so that you know you understand how these medication classes work. Um, and sometimes you can understand the interaction with other medications too. Um, I'm sure some of you all have understood where or have dispensed combination medications before. Some of these medications do get combined. Um, you might see like an ARB and the thiazide we combined at one point or another. You might have seen a calcium channel blocker ARB or thiazide. You might see combination medications. You might see two combination or three medication combined. But those combinations, you still need to know the pathways and how they work in each of these combinations, just in case the test is going to ask you. And they're not going to ask you, okay, what class is lisinopril? And they're not going to ask you something simple like that. They're probably going to ask you more so they're probably going to list out all the different medications and see what medication would help prevent a side effect, or what medication is going to help with further decreasing blood pressure, or you're going to need to think more clinically here. So more on the mechanisms and understanding how they work. So that's pretty much it here. So this is a diagram of the thiazide diuretics mechanism. So in this diagram, you could see probably three green squares here. I drew it for the purpose of just educational purpose to show you and illustrate process of how thiazide diuretics work. So we're going to imagine some symporters or co-transporters are, types of channels that sodium chloride is using to get reabsorbed back into the bloodstream. So if you look at the kidney and within like the nephron area, one of the parts of that nephron is the distal convoluted tubule. And within that part, there are those symporters and co-transporters that are used to reabsorb that sodium chloride back into the blood. And when it gets reabsorbed, that's what's causing an increased blood pressure. So when the thiazide diuretics is used, it blocks these symporters or the co-transporters when sodium chloride is being reabsorbed. Rather than get reabsorbed, it just continues down the distal convoluted tubule and then works its way to excretion rather than having it reabsorbed. And this is one way of reducing blood pressure. So let's take a look at this diagram here on ACE inhibitors and see how they work. Normally, before an ACE inhibitor starts working, when your blood pressure gets too low and your sodium levels drop, the kidneys release this enzyme known as renin. Renin is used as a way of regulating the blood pressure, or in the process of regulating blood pressure, which you see in this diagram here. The renin goes through the blood and then targets some of the liver products, which one of them is an inactive protein or peptide that liver produces, which is angiotensinogen. And what happens here is angiotensinogen converts to angiotensin 1. Um, Once the angiotensinogen goes from the liver into the blood, renin is being used to convert that enzyme to angiotensin 1. And then it goes to the lungs, or the um, vascular endothelial, the parts of the lungs where blood is carrying angiotensin 1 to there, so that it can convert to the final product, which is angiotensin 2. Now, ACE is the enzyme that comes from the lungs. The lungs produces ACE, which is the angiotensin converting enzyme. And that converts the angiotensin 1 to angiotensin 2. And angiotensin 2 is where it actually increases the systemic vascular resistance, and then raises the blood pressure. So what happens with blood pressure? How blood pressure increases? It's normally when there is a bunch of like uh, you know, sodium, for example. Sodium, when that goes up, your blood pressure is definitely going to go up. Sodium and water follows that sodium pathway. So that absorption into blood is going to cause that blood pressure to increase. So vasoconstriction is going to occur. You're going to see a lot of aldosterone release. ADH is stimulated. So all those kinds of things happen, and then it's going to, and as you may or may not have known, but sympathetic activity occurs. So you're going to see that happening here. Now, when an ACE inhibitor is taken, it is blocking the mechanism where angiotensin 1 is converted to angiotensin 2 by blocking the ACE, which is in the lungs. I also want to mention one other thing, because when you take ACE inhibitor, there's more of a chance of where patients might experience like a dry cough. That's because during the because ACE inhibitors also produces something called bradykinin. So in the process, because bradykinin is another part where ACE inhibitors play a role in decreasing the blood pressure. So there isn't really fully known, well detailed mechanism or understanding as to why dry cough occurs, but it's one of the known side effects with ACE inhibitors. Um, for now, all we know is that, for now, at least for testing purposes, know that ACE inhibitors are used to block the conversion from angiotensin 1 to angiotensin 2. So take a look at this diagram. It is very much similar to the one in the where the ACE inhibitors work. The only difference here is that it blocks the final part of the pathway here, which is where the angiotensin 2 binds to a receptor known as angiotensin 2 type 1 receptor, or AT1 receptor. Those AT1 receptors are actually located throughout the body and the organs, and that's where the action actually occurs. So when the angiotensin 2 binds to that receptor, it will cause an increase in the blood pressure and vasoconstriction, sympathetic activity, and all of that. So in order to prevent that from happening, ARBs is being used to block that or inhibit the um, uh, the part where the angiotensin 2 binds to the receptor. So it's blocking that part of the pathway, blocking the or inhibiting that binding to the receptor. So this is a diagram showing how calcium channel blockers work. You can see in this diagram, I just drew a illustration of some sort of cardiac cell containing those calcium channels where calcium is flowing inside the cell. Whenever, you need heart to get contracting, or you need muscles, more of the smooth muscle contraction and to occur, calcium needs to go into that cell. So what happens here is that contraction, it gets reduced when the calcium channel blockers come in. Calcium channel blockers block that calcium channel so that calcium does not go into the vascular cell or the cardiac cell where the contraction occurs. Instead, it relaxes the vascular part of that tissue so it can kind of reduce the blood pressure overall.